what do we have for the oral treatment? So usually it's the course of antibiotics. So the choice of antibiotics would be lymecycline, doxycycline, your oxytetracyclines, your erythromycins, you've got your trimethoprim, and you've also got Spironolactone, which is not an antibiotic and is usually used for blood pressure and heart failure. Trimethoprim is, as you know, is also used in urinary tract infection, but also works for acne as well. Now, lymecyclines, doxycyclines, and your oxytetracyclines all belong to the same class, but out of those three, I'll be going for lymecycline for 108 milligrams. It's taken once a day, doesn't cause as much side effects as your doxycyclines and your oxytetracyclines, which is usually diarrhea and abdominal cramps. And also with the ease of dosing, it's only once a day. Your doxycycline can be once or twice a day. Your oxytetracyclines, you have to take quite a few tablets. And the concern about oxytetracycline is that it can also permanently stain the teeth. So my preferential choice would be lymecycline and epidural taken as a combination of antibiotics. If lymecycline is not working, then you consider your other options such as your erythromycins, your trimethoprim, your doxycyclines, or your oxytetracyclines. But lymecycline is safe and doesn't cause as much side effects. Now, another option to consider, especially in women, is the contraceptive pill. Acne, as I mentioned, can be due to overproduction of the oil glands. It can also be due to hormonal imbalances, where you've got your testosterone imbalance, estrogen imbalance, as well as your LH and FSH. And some women have a condition called polycystic ovarian syndrome, where basically acne is one of the symptoms, and you find that the best option to go for is actually the combined contraceptive pill. The mini pill in some women can actually make your acne worse, so you want to go for combined because you've got both the estrogen and progesterone, which helps to rebalance the hormones. The best choice of treatment in terms of the oral contraceptive pill for acne is either your yasmin or your dianette. Yasmin or dianette are very effective for acne. They're also contraceptive pills, but because they have high estrogenic properties, it is usually advised not to use those pills for more than 2 years after the treatment has worked. So you use this like any other contraceptive pill, where you basically take 21 tablets and you've got your 7-day free, so you don't have to worry about contraception, while at the same time it clears your skin. Do bear in mind that you can't just go out and take the contraceptive pill. Your doctor needs to make sure that you don't have any risk factors for having a blood clot, such as having a high BMI or any family history of blood clots, before you qualify to go for any of these contraceptive pills. Now, we've talked about the antibiotics such as your lymecyclines, your spironolactones, your contraceptive pills, but some people actually find that the best treatment out of all these treatments is Roaccutane. Now, Roaccutane is an oral retinoid. It's basically like a magical tablet. It just clears out your skin. But like I said, if it's hormonal, you might want to consider a hormonal option instead of Roaccutane. Roaccutane has to be prescribed by a dermatologist because it does have side effects. You need to be monitored. It can affect your liver, it can affect your cholesterol. If you're trying for pregnancy, then you might want to avoid Roaccutane because it can cause birth defects in the baby as well. If you've got mental health problems such as anxiety or depression or psychosis, or you have a history of suicidal thought, then Roaccutane is also a medication that you would want to avoid because Roaccutane can actually worsen your mood symptoms. However, Roaccutane is very effective, and in most cases your acne doesn't come back, or it might take a few years before it comes back again. So I hope you've enjoyed this video. Please feel free to share, like and subscribe.